Now, the World Health Organization estimates that about 100 million people globally are pushed into poverty every year because of out-of-the-pocket expenditure on healthcare. Now, with a proportionately bigger burden of disease, developing countries are affected more. But now there is a global push for countries to provide universal health coverage. BBC Africa's health correspondent Anne Soy has been finding out if national health insurance schemes are viable.
23-year-old Rita Kio is preparing a snack for her cousin Edgar. The lad has been unable to swallow anything since he was diagnosed with cancer of the esophagus. So his caretaker blends his food and feeds him through this tube attached to his stomach. Rita has volunteered to do this until he recovers. He says he's alive today because of such acts of charity and a much-needed medical cover.
Were it not for the national insurance, I would have died by now. And I wouldn't blame my parents because they just can't afford to pay for treatment.
He is on a 5-week course of radiotherapy and chemotherapy at Nairobi Hospital, one of Kenya's top private health facilities. The treatment costs $5,000. It would have been cheaper at a public hospital, but that would have meant joining a long queue that could take months before he gets treatment.
You need very strong healthcare systems, and if you have a community and communities that realize that health is a right, then it means they can agitate for the best services possible. So all these things have to work in tandem to ensure the quality of healthcare is as best as it could and as affordable as it should be, and the financing as well is available for people.
The majority of workers in developing countries like Kenya are in the informal sector. Many of them do not have predictable incomes, and for that reason, almost all of them have not subscribed to national insurance schemes or any insurance plan for that matter.
Kenya's National Hospital Insurance Fund has been trying to grow its membership by visiting villages and small towns to recruit more contributors, mainly from the informal sector. With each sign-up, a family of up to 6 gets the insurance cover at $5 a month. With the cover now extended to include private hospitals, patients like Edgar will no doubt get better quality care faster. But for the general population to get this kind of care, the public health system will also need to be improved. Anne Soy, BBC News, Nairobi.
Well, several African ministers of health and private sector decision makers are meeting in Nairobi to discuss the issue of universal health care. Among them is Dr. Amit Thakur. He's the chairman of the Kenya Healthcare Federation, and he joins me now from Nairobi. Thanks for taking time to talk to us on the program. How possible is it for all African countries to provide affordable, prepaid health insurance?
Thank you, Sophie. It's actually quite difficult, and it's a subject that we've been discussing all day today to find out what is the best way we can find a large pool of people into the universal healthcare coverage. The main challenge is the amount of resources. It's very difficult to balance contributions to the benefits that are demanded by the citizens who live in all the places in Africa. The two countries that gave example today were Ghana and Rwanda, and they displayed the kind of structure that they've embarked on to have a larger pool of citizens covered.
All right. So in the case of a program like the one we've seen in that report, how do health institutions deal with the cost?
You know, the whole issue is the health institutions are either paid out of pocket by many families who visit their facilities, or they are paid through an insured scheme. Majority of the health institutions and providers in Africa receive the payments out of pocket. And that's the reason why we have this high burden when patients are ill and they cannot pay for their costs, leading to many families going into poverty. So these are known as catastrophic expenses. It's something that's really critical for us to discuss and find solutions to.
All right, so you mentioned solutions there. What can governments do, and can they really deal with the whole issue of health insurance on its own, or should other sectors come in and chip in somehow?
Exactly. That's the reason why we are meeting here with over 400 leaders and champions and several ministers and even African Union. It's very clear that we need two ingredients. One is partnership and the other is leadership. It's very clear that both public and private have to work together to provide better healthcare and coverage in Africa.
All right.
Some of the solutions include mixed systems. We realize that we are not going to be able to cover or provide insurance to the 1 billion African citizens. So a mixed model is the best way to go to provide better healthcare.
Okay, so that's one of them. There have been suggestions related to innovation, usage of mobile apps to provide easier access to healthcare. Are there other ways that, access can be made easier for the individual?
Absolutely. So the private sector have put the 5 game changers that we believe we can offer to the public sector and the citizens of Africa for better healthcare. And these 5 game changers include disruptive innovation in technology in healthcare. The second is innovations in human resources for health, training better quality of health workers and increase the number of health workers. The third is to reduce the cost of supply chain. And finally, it's healthcare financing together with public-private partnership to foster greater investments. These are the areas that we think are the game changers. And together with McKinsey & Company, we've charted out that in 5 years, we should see $25 billion new investments in Africa that will enable us make the difference.
All right. Dr. Amit Thakur, thank you for your time and thank you for talking to us here on Focus on Africa.